Do you want to breastfeed the baby or you don't want to? Have you made that decision yet? So many patients, they are very clear that they don't want to. They have seen their mothers not breastfeed, they have seen their sisters not breastfeed, babies on bottle all the time, and they're very clear about it. They don't entertain the idea of breastfeeding. And if you are one of them, obviously you don't need to watch this video. But if you are someone who wants to breastfeed, but it's like shit scared of breastfeeding and all the issues which come with breastfeeding, keep listening. All you need to do is just decide, are you going to breastfeed? Because trust me, the discomfort is there both sides. You bottle feed or you don't bottle feed. The discomfort with feeding a baby always exists. We think it gets easier with bottle feeding because it's just like make the bottle and put it in the mouth. It's the same process for the baby. Put the baby on the breast. It's the food delivery system, right? But the food that is available with the breast is way, way, way better than the food available through the bottle. Both the things have associated risk and benefits. Bottle feeding is now considered equivalent to alcohol. You can't even market it anymore because it's not good, it's not recommended. Breastfeeding has lots of benefits and it comes with, it's all pre-programmed really. You don't really need to do anything. Just figure out a way to let the baby feed on you. That's how we are programmed to feed our babies. For at least 1 or 2 years, there is enough food on us that the baby can sustain. But most patients get worried, and it's so complex because they worry about either the milk is not going to be enough or it's just going to be so painful, or sometimes, like in my case, it was like, God, she's always so dependent on me. Like I'm the only one who can solve her food problem. There's no one else who can help me out with it. It's just me. So our brain has a capacity to demonize both the options. So I want you to decide first and foremost, are you going to breastfeed or you're not going to breastfeed? If you're not going to breastfeed, do not let any thoughts about breastfeeding come to you. Like patients who have had cancer or have implants or who are taking medications which go through the breast milk to the baby, they can never breastfeed the babies, right? So even if they want to breastfeed, they can't. So they most of the time make peace with it, that they don't want to breastfeed. But if you are thinking that you want to breastfeed but are scared around breastfeeding, bring it to the coaching call. I will obviously make so many more videos around fears around breastfeeding, but it's something which is in our mind. The fear is in our mind. You have the system functional. You can use it for the best outcome. So, are you willing to breastfeed? Is the first and foremost question that you need to answer. If no, don't let any of those thoughts come to you. If yes, then figure a way out to deal with it. Like if you decide that, okay, my baby is going to get food only through my breast and nowhere else, at least for the first 6 months, then anything which comes along can be figured out. Any of the problems. And bring it to the coaching call. It's a very mind fucking experience with breastfeeding and the pain and the sleeplessness, and it all can be figured out by just talking to someone about it. All right, so decide.